Hi, everyone. Thank you for joining us today for our sixth episode of Mazars Healthcare Digest. Today, we're going to be talking about best practices for health plan internal audit. My name is Laura Peth. I'm one of the principals of the Mazars Healthcare Consulting Practice, and I lead our regulatory and compliance team. In that role, I've been working with various types of healthcare entities for nearly a decade on all sorts of regulatory and compliance operational areas to include internal audit. I have a master's degree in public policy. I'm certified in healthcare compliance, healthcare privacy compliance, and I'm a certified fraud examiner. Joining me today is Jennifer St. Marie, one of our senior consultants. Jennifer?
Hello, everybody, and thank you for tuning in to this episode. My name is Jennifer St. Marie, senior consultant with Mazars Consulting. I'm a member of our regulatory compliance team out of our Sacramento office. I'm also a certified healthcare auditor, and I've been working in managed care and healthcare regulatory compliance for over 10 years now.
Wonderful. So let's go ahead and look at our agenda for today. During our discussion, we're going to cover 6 major topics: how you should determine what to audit, things to consider before you begin an audit, internal auditor conduct, sampling methodologies, and what to review when auditing. I'm going to hand it over to Jennifer to get us started.
How to decide what to audit. Before you begin, you need to develop an audit work plan. In order to do this, you need to be familiar with the Department of Health and Human Services Office of Inspector General work plan. It's strongly recommended that internal auditors review the OIG work plan and conduct internal audits by integrating the OIG recommendations into their audit process. You should also consider previous corrective action plans and/or enforcement from state and federal agencies. You should also take into consideration conducting a gap analysis. Gap analysis is a business assessment tool where a company compares its actual performance with its potential performance. It provides the company insight into areas that have room for improvement. Also, has a risk assessment been conducted? In a risk assessment, potential risks are identified, evaluated based on probability and severity, and used to develop plans to eliminate the potential risk. Also, it is important to remember audit work plans must be approved by a governing board, such as a board of directors or compliance committee. The OIG recommends larger organizations to establish an audit committee to prevent key stakeholders from swaying how internal audits are performed.
Excellent, Jennifer. And I know, the OIG work plan from the Department of Health and Human Services is formally updated on an annual basis, but they update that area of their website every month. So it's really worth taking a look at frequently. So Jennifer, when you're conducting a risk assessment to inform your internal audit work plan, do you limit it to certain areas of the organization, or do you want to do something very broad covering all operational areas?
It is suggested when you conduct an initial risk assessment, especially for a company that has not had one done before, that you do a broad assessment of all operational areas. Now, keep in mind that the things you want to evaluate on the risk assessment should take into consideration things on the OIG work plan and your previous corrective action plans or enforcements.
Jennifer, how often should internal audit update its work plan? Is it something that should be developed as an annual work plan or more frequently? What works best?
It's recommended at least annually, but for larger organizations, you may want to consider adjusting it biannually. This does need to be reviewed and approved by a governing board, such as a compliance committee or your board of directors.
And that's important because the compliance committee or the board of directors might have a higher level viewpoint on risk to the organization, and they could opine on maybe if something isn't included that should be, or your work plan could actually inform them of a risk that they previously weren't aware of.
Exactly. And those boards can also help to prioritize the list as well, based on need. Things to consider before you audit. Before you begin an audit process, you need to ensure what you're being asked to review actually exists. This could be largely determined by your audit period or your look-back period. You need to ensure the process you're auditing has been implemented before you begin. And again, this is largely determined by your audit period or look-back period. Something may be effective today that wasn't effective during your look back period. So it's important that you take that into consideration and review your documentation against the criteria that was established during your look back period. Once you've established that there is a system in place that you can audit, you need to determine whether or not it is effective. And again, you do this by looking at the information and compare it against the criteria that was applicable at the time. Not only do you need to look at whether or not it is effective, you need to ascertain whether or not it is compliant.
You know, Jennifer, I think it's really important that you mentioned keeping the actual look back period in mind. It's very frequent that we will find internal audit that has criteria that's either outdated for the look back period or includes requirements that weren't in effect during the look back period. And this really speaks back to the prior discussion about your work plan and really determining for your operational needs, is it better to do that work plan on an annual basis or biannual? Some reasons you might decide to update your work plan more frequently are if there are major regulatory changes that affect the compliance requirements within your operation. A good example, of course, is grievances and appeals. There are often changes to some of the requirements in the notifications or how those are categorized and handled, and making sure that we can evidence compliance in the appropriate look back period is important. So Jennifer, when we're talking about auditing for compliance, I think it's really important to note that your audit can look at the compliance criteria, of course, but what's almost more important is the process itself producing evidence of compliance? An organization can be performing a process in a manner that is completely compliant, but if the process itself doesn't produce evidence of compliance, they're going to have difficulty when external regulators come in. One trap that internal auditors can fall into if they're not careful, because they're a part of the organization and familiar with the processes, they can sometimes have a little bit of a blind spot to what it may look like to an external regulator or auditor. So always keep in mind, is the process producing evidence of the compliance before, as an internal auditor, you say it's compliant or not?
Yes, exactly. If it doesn't exist in a document, it does need to be documented, because non-existent documentation means it doesn't exist at all to an external regulator.
Right, and we want to make sure your organization's getting credit for all of the good work they're doing.
Internal auditor conduct. It is important for an internal auditor to remain independent from anything that they are asked being audited. This means that as an internal auditor, you cannot be a part of the implementation of a new guidance or regulation or new process and then turn around and audit that process, as you need to remain impartial at all times to anything you're auditing. Internal auditors also need to be approachable, honest, and fair in all of their tasks. Remember to be calm and patient and courteous at all times, even if it's taking a while to get the information that you've asked for. It is important that you plan and manage your audit process from start to finish before you dive in. This audit plan needs to state the objective and scope of the audit. Internal audits are always executed by comparing the item, system, or process to a particular standard or expectation. This audit plan needs to include the time frame, which means your audit period or look back period. What will be expected and how many? How many auditors will be needed with what expertise? While I am a certified healthcare auditor, I am not a clinician. Therefore, I cannot audit utilization management determinations for medical necessity. I would need the assistance of a clinician, such as a registered nurse or physician. Make an audit checklist to help you manage your audit and keep things on track. You need to hold a kickoff meeting with senior staff and key players prior to diving in. During this meeting, it is important that you agree to the timelines of the audit. This includes the look back period and how long it will take you to conduct the audit and provide them a draft report. During this time, you need to state the criteria that you will use during your audit, the number of samples you will audit and the systems to be audited. The auditor should never create any criteria themselves to be used during an audit. You always verify the documentation provided against applicable requirements. Note that applicable requirements includes both internal and external policy. This means if you have an internal policy that is more stringent than existing external policies, such as the CMS regulation or a state regulation, you need to audit to the more stringent internal policy. As an external reviewer, we'll hold you accountable to your higher standards. You need to record your nonconformances objectively. And in certain cases, it is best to discuss pervasive or gross nonconformances with legal counsel prior to documenting them. In certain cases, such findings could lead to self-disclosure, which is something you need to discuss with internal senior staff and possibly legal counsel prior to documenting. Always verify the accuracy of your report before you send it out for everybody else to review. You need to ensure that you can justify your analysis and conclusions. This means that you have documentation that says one thing and criteria that don't align in the case of nonconformances. Be prepared to make revisions to your draft report. It is common after receiving a draft report that additional information may be provided that suggests your findings need to be reviewed and you need to go back and take a second look. I've had audits before where after I've provided a draft report and additional information was provided because the initial information that was provided was old information on somebody's desktop and not the correct information. So it's important that you take this into consideration during your draft report period and be prepared to relook at, re-review, and redocument. Always submit and discuss the report with appropriate senior staff.
So Jennifer, I really like that you mentioned the need for internal auditors to be calm, patient, and courteous. And of course, recognize that we're all humans when we're requesting information and there are delays. One theme I've noticed on occasion in performing audits, if after multiple delays and patience, you're not able to receive the data or documentation that should be integral to a function in order for it to operate, that in and of itself should be a finding in your report. So that's an alternative route to go down when you're not provided timely data or documentation, especially when you notice that the reason behind that is it can't be pulled quickly or put together quickly. If your operational area that you're auditing cannot pull that information for you as the internal auditor, they are definitely going to have difficulty pulling it quickly for a regulator with much tighter timelines. So it is important when you have those issues to get that in your report and make sure that it's something that can be improved upon for the future.
Yes, exactly. I've had audits and I have conducted internal audits that resulted in such findings. I documented in the report, but remember to remain objective and not implicate anyone. The report simply stated that such and such department was unable to provide documentation proving, and then cited the criteria.
Earlier, you talked a little bit about considering talking to internal legal counsel before documenting issues of nonconformance. As an internal auditor, what kind of judgment do you use when you make that determination?
As an internal auditor, if you were to come across such findings that were so nonconformant that would result in an enforcement action from an external governing body or would require the plan or entity to self-disclose such nonconformances, you should stop and consider legal counsel prior to documenting. As an internal auditor, I was asked to audit a human resources department of a particular business that was a union shop. The Human Resources Department had no way of documenting or verifying that employees had received the proper onboarding and training. In a union shop, this could go very badly for the company. This was something that I stopped and considered legal counsel and asked advice on how to objectively document this finding and the corrective action so that this would be corrected as soon as possible.
And is there any necessity aside from talking to legal counsel to inform the chief compliance officer as well?
Yes. The chief compliance officer should always be informed on when you need to seek legal counsel, unless, of course, the nonconformance is the direct result of the actions taken by the compliance officer.
Jennifer, I think this is a really important note. We can't get into all the nuance today, but the mission and scope of the chief compliance officer and general counsel within an organization are different. So it's very important to think through, in situations like this, the appropriate channels and who to inform. One other thing I wanted to note, you mentioned to make sure we're submitting and discussing the report with appropriate senior staff. Would you agree that that's really something we should discuss and agree upon at the kickoff of the audit? Who's going to get the report?
Most definitely. And this should also be included in the timeline. For example, you would say, I'm going to request and list the documentation and the sample sizes requested in the kickoff meeting. You say, I will request it on the 1st of June to be delivered by the department that's responsible for the delivery, the 30th of June. Then your timeline should also state that you will spend the next, depending on the size of your audit team and the department being audited, anywhere from 2 to 4 weeks, and that you will have the draft report to the senior staff by a specific deadline. And then your timeline should also state how long the senior staff will have to review that draft report before meeting again and then discussing. It's very important that they have the report, the draft report, before you meet again to discuss the nonconformances and corrective action plans. It is at that time you can discuss when you will meet back with a final report.
I think that's so important. Communicating all of that at the beginning, negotiating it, sticking to it throughout the internal audit process helps gain collaboration from your auditees because there's no surprises. Good advice.
How many samples are enough? Some people think that there is a statistical rule of thumb. That is not true. There is no such thing as a statistical rule of thumb. The larger the sample size, the larger the comfort level of the organization will have about the results. However, this does not mean you need to review 100% of everything. If you can explain to your auditee confidence levels and precision levels. A confidence level is the degree to which we believe an estimate drawn from a random sample will fall within a specific range. For example, a confidence level of 95% means that there are 95 chances out of 100 that the sample will not vary from the true population, but there's a 5% chance that it will. Note that there's no such thing as a 100% confidence level without reviewing 100% of the population. In order to justify your confidence level, you need to know a little bit about precision levels. Precision refers to how close your values of the sample statistic are to each other, or how wide the sampling distribution is, which can be expressed as the standard deviation. The standard deviation measures the variation within a particular population. The more unlike the items are in the population, the greater the standard deviation. It's very important for an auditor to have knowledge of the variation within the population when determining your sample size. The greater the spread, the larger sample size you will need. There are a couple of programs and softwares out there that you could use to help determine your sample size. The one that is largely recognized by most healthcare organizations is RATstats. It was developed by the Regional Advanced Techniques staff in San Francisco and has been used by the OIG since the early 1970s. It is a package of statistical software designed to assist in selecting random samples and evaluate improper claim payments. We don't have time to delve in how to use RATstats exactly in this video, but there are training videos free to you on the web if you are interested. Another fantastic program to use when determining sample sizes or making sample selections is Excel. Excel has the ability to generate random numbers or form pre-selected number ranges. With Excel, you could generate a random sample, generate a random number of samples needed for review, or generate a random number within a designated range. We don't have time to delve in how to do this exactly during this video, but there are free videos available to you on the web if you're interested in learning how to use Excel to make your samples.
Jennifer, these are excellent tips. I think another thing to keep in mind is you don't necessarily always just use a random sample depending on the type of audit you're doing. You can judgmentally select a probe, especially in a risk assessment type of situation where you're trying to develop your work plan to try and detect issues. You can do a more stratified sample if your internal audit criteria is very focused on a scope of, say, only your highest paid facility claims. Therefore, you don't want to just randomly select any paid claim within the period. You want your random selection of claims to be limited to the population of facility claims, and within that population, the highest paid claims within the period. So there are a lot of different sampling methodologies that we can apply to make your internal audit as impactful as possible.
That's exactly right, Laura. This is why knowledge of the variation of the population and take into consideration your objective and scope of your audit are very important things to consider when selecting your samples.
And Jennifer, I know sometimes when I've worked with folks about how many samples we're going to pull, the reaction can be either, wow, that's way too many, or wow, that's way too few. In explaining statistical relevance to people who maybe are not experts in that area or don't work with internal audit a lot, are there any metaphors you like to use to talk to them about why your sample size is appropriate?
Yes. A metaphor I like to use is candy. If you have a bowl of jelly beans and you reach your hand in, you pull out a handful of jelly beans. And in your hand, you have a total of 13 jelly beans. 10 of them are red, 3 of them are white. If you reach your hand in the bowl again, do you really think you're going to pull out more white jelly beans this time? People understand candy.
That's a really good metaphor.
What to review when auditing. As an internal auditor, here's some key things you need to consider when conducting an audit. On-site visits is an important one. You may be working for a health plan who has delegated specific functions to downstream entities. So it's important that you conduct on-site visits to those entities. Internal audits should always include interviews with key staff that are involved in the process you are auditing. You need to develop your questionnaires in advance and ensure that each question is an open-ended question. This means you don't ask questions that can simply be answered by a yes or a no. Set them up for a question that gets them talking and sit back and listen. When being asked to review anything to do with claims, you need to review medical and financial records and other documents that pertain to the claims reimbursement process. Claims reimbursement process can be very cumbersome, so ensure you have the proper expertise to conduct such a review. When conducting a review of a hospital or a provider, you need to review the written material and documentation prepared by the entity. You should also consider conducting trend analysis or longitudinal studies in specific areas over a given period. This can be particularly helpful in discussing your findings with management at a later time. As a reviewer, you should always be independent of physician and management of the process you are being involved in. This means if Uncle Joe is a physician of a practice, you cannot go audit Uncle Joe's practice. If your best friend and roommate from college is the manager over a process that you're being asked to audit, you might want to consider your independence from that manager before you begin. You should always have access to existing audit and healthcare resources and key staff over all relevant areas which you are asked to audit. If you do not have access to all of these, you're likely to miss something, and I guarantee you an external reviewer will have access to them and they will not miss something. Throughout the audit process, you need to regularly present written reports on compliance activities to your CEO and governing body. This could be your board of directors or compliance committee. This allows you to remain transparent in all of your actions as an internal auditor. You should specifically identify areas where improvements are needed and track those improvements made based on audit recommendations over time. It is important that you continually report on those over time. I've encountered situations where corrective actions were suggested and the advice was not taken. You still need to report on those because in my experience, an external auditor will find and make the same recommendation at a later date. We want to ensure that nobody is blindsided by an internal audit finding or an external audit finding.
Jennifer, you mentioned looking at trends during the audit process and how that can be helpful later on when you're discussing your findings with leadership. How is that helpful?
It could be that your trend analysis shows a spike in nonconformances or maybe a spike in turnaround times not being met. This could be because a new process was implemented, or it could be something as simple as a system update was done that required more manual work and less automation, which caused for a delay. It may not result in a nonconformance, but it could definitely result in a business process improvement.
I completely understand. I think trends like that can really help you pinpoint the root issue of why nonconformance is happening. I've, for example, seen in a few internal audits when there's a spike in nonconformance in a certain functional area, it often coincides with employee turnover or management turnover, as well as system implementation, like you mentioned. So I agree, doing some trend analysis is important. You mentioned using questionnaires that ask short, open-ended questions. Is there a reason that you prefer open-ended questions in a questionnaire or in an interview?
Yes. Open-ended questions allows the interviewee to guide where the interview will go. You might want to have a few questions to get them back on track, but you want to ask questions like, walk me through the process of, and let them explain the process, and then ask questions about anything from there. Asking yes or no questions allows the interviewer to determine where the interview is going to go.
I completely agree, Jennifer. When you ask yes or no questions, you're often going to miss out on important information.
And now we come to our final takeaways. The highest praise an auditor can receive is that the audit was conducted fairly. Keep in mind that experienced auditors know that the purpose of an audit is to identify risks, and the objective is always to mitigate those risks. You need to organize and document the audit standards and criteria to be used to determine the nonconformances, schedule and conduct an opening meeting, collect the data and information, and verify that information to measure compliance or nonconformances, and record those nonconformances objectively.
Thank you so much, Jennifer, for going over some of the key considerations when performing internal audit within healthcare organizations. I know there's a lot of ground to cover, and I think we were able to dive into some really important areas today. On the next slide, we have a little bit more information about Jennifer and myself, and I'd really like to encourage our audience to please feel free to reach out to us at any time if you'd like to discuss internal audit for healthcare organizations. We'd be more than happy to discuss those concerns with you or provide any advice we can. Additionally, on the final slide, we have a few of the resources we discussed today linked so that it's easy for you to take a look at them.
Thank you so much for tuning in to this episode of Healthcare Digest presented to you by Mazars Consulting.